Travel back in time with a trip inside the Iowa's News Now vault.
Hospitals in Iowa, like this one, get almost 40% of their money from treating Medicare patients like Eva Clark. But the government is revamping the way it pays hospitals for Medicare, and that shakeup is sending waves of anxiety throughout virtually all Iowa hospitals, through almost every person who cares for Medicare patients. Eva is a 68-year-old Cedar Rapids woman who came to Mercy Hospital for knee surgery. In the past, the hospital would have spared no expense in treating her. Because Eva's on Medicare, the government would have reimbursed Mercy no matter what it spent on her surgery. In fact, the more the hospital spent, the more it earned, but no more. That blank check attitude is gone forever. Now, almost as soon as the patient walks through the doors, the hospital will know exactly what Medicare will pay to treat that patient. If the hospital spends less money than Medicare will pay, it makes money. But if it spends more to get the patient better, it will lose money. Mercy Hospital will lose money treating Eva, but it says that other Medicare patients will make up for that.
We think initially that we're going to actually make more money. Then eventually they'll begin to ratchet down the amount of reimbursement in each DRG, so eventually we'll get squeezed.
DRGs, or Diagnostic-Related Groups, is what the government's calling its new Medicare reimbursement plan. It affects all major hospitals nationwide, including Mercy. Health professionals welcome the government's attempt to coerce hospitals into controlling their Medicare expenses, but many contend that under DRGs, healthcare will suffer.
I think it was drastic.
Judy Munchow is the executive director of the Visiting Nurses Association.
Some of the dire consequences will be people will be coming home much sicker than they were before from the hospital.
Sicker because Munchow and many others fear that under DRGs, hospitals might release Medicare patients early to avoid losing money. For example, the government says that from now on, it will pay Mercy these exact amounts for each Medicare patient admitted for these problems. It will lose money on Eva's knee replacement because the procedure costs the hospital more than the $5,800 the government will pay it.
This leads to a bureaucracy in which the dollar sign is going to be the thing that's going to control the type of care that's given.
Dr. Sedlicek of Cedar Rapids says he's had enough. He's so fed up with DRGs and federal bureaucracy that come this fall he's giving up his practice, and he expects that other doctors will also call it quits. Plus, because of lower Medicare payments, he says DRGs might shut down a dozen or more hospitals within 2 years. Most would be rural hospitals. Recently, we told you that this Monticello hospital is having serious financial problems. Officials there say DRGs are intensifying its financial woes and its future is uncertain.
At the present time, this is only in the hospitals, but I think very quickly there's going to be a DRG system that will be developed for outpatient work and for the physician's office. I think you're going to see a significant number of physicians in my age group who know what the practice of medicine was like in the generation past, and they see what it's going to be like in the generation to come, and they're going to look for alternate ways to practice medicine and maybe give up medicine.
Most agree DRGs are not the final solution, rather just an attempt, flawed as it may be, to give us all quality health care at affordable prices. Tom Eisen for Iowa Tonight.